What's going on, my people? This is your host, Blanche Eden for Black Trending News. Today we're going to be doing episode 39, and we're going to be talking about Xanax and Valium. These are prescription sedatives that you hear in popular rap songs. You even hear them in R&B songs. They're everywhere. They're in your doctor's office. They're on TV. They're in your conversation at work. These are very popular drugs that are prescribed to ordinary people. So we're going to be talking about the crisis that's going on with that. Also, we're going to be talking a little bit about what goes on between pharmaceutical companies and your doctors. We're going to be talking about how they are influential on your doctors, and then in turn that kind of falls down on you, especially if you take medication. So let's get into it. America is now very much aware of its opioid epidemic, but there's a hidden crisis quietly stirring with prescription sedatives such as Xanax and Valium. A new review warns, otherwise known as benzodiazepines, overdose deaths involving these medications have increased exponentially over the past 10 years, with a steady growth in prescriptions for these drugs. The use of these drugs have become too casual in modern society, says Dr. Anna Lembeck, an associate professor of psychiatry and behavioral sciences with the Stanford University School of Medicine. She says these are highly addictive and potentially lethal drugs, and many people don't know that. Sadly, most physicians are also unaware of this and blithely prescribe them without educating their patients about the risk of addiction. Now, that last statement that she quoted, I disagree with it. I truly believe that doctors are in the business of making sure their drug supply gets distributed somewhere, and that doctors and the pharmaceutical companies have an influential relationship. I want to talk about what pharmaceutical companies are doing to, quote, build their relationships with who could be your doctors, and then come back to the Xanax addiction. Award-winning journalist Melody Peterson details the prevalence of corporations that have been created to ghostwrite articles for the medical literature, which portray new medications as being comparatively more advantageous than existing medications, safer for the patient, and as a result, an advancement in the treatment of disease or illness. These ghostwritten articles invariably present the results of clinical trials in a manner that distort the drug's potential advantages, while simultaneously minimizing potential short-term, long-term, and even fatal complications. This is often accomplished by selecting clinical trials that appear to demonstrate the new medication's advantages while eliminating those clinical trials that do not support its safety. Peterson describes classic Madison Avenue marketing approaches by drug companies to promote their medications much in the same way that non-medical commercial products are marketed to consumers. The drug companies create a marketing theme and relentlessly promote that theme, creating sometimes false and often dangerous impressions about their newer and profitable medications. As an example, Peterson goes into great detail about the marketing of narcotic painkillers. These painkillers were formerly thought of as appropriate for cancer patients, but not appropriate for the generalized treatment of chronic pain. The theme of the marketing efforts was and continues to be that the dangers of narcotic painkillers have been overstated and that patients are needlessly suffering because of the myth of drug dependence or addiction. One company in particular flew healthcare professionals to resorts like Boca Raton, Florida, and Scottsdale, Arizona, where they were wined and dined and trained as speakers to spread the word that painkillers like Oxycontin were safe. As Peterson noted, for thousands of Americans, this proved untrue. So, if you're on medication and you're unsure about whether your doctor is prescribing the right thing for you, it's really up to you. Or even if you're thinking of trying medication because your doctor suggested it, it's really up to you to look up that medication and verify whether that's appropriate for your ailment that you have. Because, and I'm about to get into it, but doctors can prescribe you off-label medications even though it's not particularly for your actual disease that you have. So definitely always know what you're putting in your body. There are thousands and thousands of people who do not do that. They trust their doctors. Not to say you should not trust your doctor, but you also need to know for yourself and read it with your own two eyes. Now, Peterson documents that drug companies fastidiously collect information on the prescription patterns of physicians and surgeons by collecting pharmaceutical information. By collecting data on their prescription habits, drug companies can identify the physicians to target in their effort to reward those who prescribe their medications, as well as influence those who do not. Peterson describes the direct financial rewards provided to physicians and surgeons, which have included trips, meals, and direct cash payments. As Peterson noted, doctors have continued taking the loot, despite studies showing that even gifts as small as a pen could imbue them with the sense that they owe the pharmaceutical company a favor, a quandary that could be quickly solved by writing more prescriptions. This is legal. This is obviously legal because it's happening. So what you have to do as a patient is always be aware and be thinking of your health as a priority, which means you need to do your research so that you can have these kind of conversations with your doctor and you're just not like a sheep going in there and taking whatever people give you. One method of rewarding physicians who frequently prescribe a company's medications to their patients is by compensating them as speakers for the company. Peterson documents that a marketing firm called Thomson Physician World said in a 2002 brochure that it had signed up more than 20,000 physicians to speak on behalf of the drug industry. These doctors, Physician World stated, would become critical linchpins in product positioning. The speaker fees are also a reward for the use and promotion of a company's drugs. So please keep in mind that these things take place. They have been documented. They are true facts. They are taking place. So it is truly up to you to know exactly what you are putting in your body. You cannot expect that every doctor that you go to has your best interest. Unfortunately, they may not. You have to have your own best interest, and also for your children and your family members, not just yourself. Now, although theoretically drug representatives are supposed to provide objective information, Peterson leaves little doubt that they are highly trained sales personnel. Their function is to persuade physicians and surgeons to increase sales volume by persuading the medical profession to prescribe newer and more expensive drugs to patients, even though most of these drugs are variations that offer little more than older medications. A secondary function of the sales representative is to assuage concerns physicians have when there are reports of potentially serious adverse consequences to drugs that have been heavily marketed to physicians and surgeons. The sales reps receive training in assuaging physician concerns related to adverse drug effects and an effective promotion of the drugs in the face of reports of those adverse outcomes. The sales reps are taught to use talking points when there are concerns raised by physicians and surgeons regarding a drug's safety or effectiveness. These techniques are highly refined and designed to deflect rather than directly answer concerns that are raised by the physician or surgeon when early reports of adverse drug events begin to surface. And you really have to think that's even if that doctor is even asking about negative side effects. Let's assume that they're not asking about negative side effects. They're going to buy those drugs from the pharmaceutical companies and they're going to dish them out to their patients. Whether their patients need it or not, they may find a reason to do it. You know, when you go to the doctor and they ask you a billion questions about your medical history, you have to understand that these doctors and nurses also have to sell this medication because they've bought it already. So now they have to distribute it out and get their money back from you and your insurance companies. So please keep in mind when you answer questions to be smart and to still keep your privacy and not be an easy, victim of something like this. Don't let anybody tell you what you need, and you should be thinking along, what are other options for me? Besides drugs, do I need therapy? Do I need to just maybe get out more? Drugs should be in my opinion, this is just my opinion, a last resort. You should always be looking for drug-free ways to deal with your issues if you can, especially if it's nothing serious, because drugs can become very addictive. And after a while, you don't even need them. Your body needs it. And then you become addicted to it. And then you got another problem. The FDA approves medications for a limited number of purposes, while drug companies are prevented from marketing these medications for other purposes. Physicians and surgeons are not restricted in how they prescribe these medications. This practice is referred to as the off-label use of a drug. Peterson extensively examines the off-label use of Neurontin, which had been a relatively weak, ineffective, marginally profitable drug for the treatment of epilepsy. As Peterson stated, the executives decided, however, they were not satisfied in selling Neurontin for the limited use for epilepsy as the government had approved. Instead, they resolved to expand their sales greatly by promoting the drug for other medical conditions that had nothing to do with epilepsy, other than they also involved the brain. The executives created an internal wish list of the other neurological conditions, each of these representing tens of thousands of other prescriptions. Peterson then discussed the illegal off-label marketing of Neurontin and the willingness of physicians and surgeons to prescribe Neurontin for off-label uses as wide-ranging as attention deficit disorder, bipolar disorder, pain, and countless conditions for which there was no evidence that it was effective. Another method that the drug industry uses to promote their products is continuing medical education. As Peterson noted, by 2005, the drug industry and other medical companies were paying hundreds of millions of dollars to the nation's accredited medical education courses, enough to cover 65% to 80% of the cost. As a result, most of the events have become little more than a pharmaceutical sales bazaar. By paying for the doctors' continuing education, the drug companies made sure they, the physicians, learn what is important for the corporate bottom line. While there have been significant positive changes since 2008, when Peterson wrote her book, there is little doubt that the drug industry will continue to mass market its drugs, even if that mass marketing takes other forms, such as direct to consumer marketing or compensating high-profile celebrities to conduct interviews or make public statements about the virtues of new medications. Whatever forms the mass marketing may take, it will impact the practice of medicine and surgery and likely raise significant legal medical issues. Now, let's get back to the topic of Xanax. They are prescribed to treat a variety of conditions, including anxiety, insomnia, and seizures. These are three really extremely popular things that people suffer from. So just imagine how much of this drug has been put out. Prescriptions for Xanax and Valium and other drugs like that increased by 67% between 1996 and 2013, from 8.1 million to 13.5 million. The quantities of drugs obtained with these prescriptions more than tripled during that same period, the researcher said. As a result, more people are becoming addicted and falling victim to overdose. Overdoses involving the drugs multiplied sevenfold between 1999 and 2015, increasing from 1,135 to 8,791 deaths. Just like with opioids, people overestimate the benefits and underestimate the risks of these drugs. They are effective for a panic attack or severe insomnia, but when taken daily, long-term, people develop tolerance and dependence. They stop working, and they can even make anxiety and insomnia worse. That is a statement from Dr. Lembeck. Many overdose deaths involve people taking a benzodiazepine with other substance, such as opioids or alcohol, the review authors added. And this is probably because once you become addicted to a drug, you want it to be stronger because you can't feel it anymore. So now they're tacking on other drugs to make the drug more effective so they can feel something. And this is really, really bad. Now, despite this, rates of prescribing these drugs with opioids has nearly doubled. There are people, doctors, prescribing and nurses prescribing opioids along with the Valium, along with the Xanax, together. Okay? Increasing from 9% in 2001 to 17% in 2013. The study found. In a review published February 22nd, 2018 in the New England Journal of Medicine, one expert said the trend is a recipe for trouble. It is important to acknowledge the risks involved in the overuse or misuse of these drugs, especially when combined with other medications or alcohol, said Bruce Goldman, who is the director of substance abuse services at Zucker Hillside Hospital in Glen Oaks, New York. While we have learned that there are more effective treatments for chronic anxiety than the long-term reliance on these drugs, many people have now been dependent upon them for years, he said. Benzodiazepines are best used intermittently, no more than a couple of times a week. More frequent use should be limited to a very short duration, no more than 2 to 4 weeks. If you're someone who's relying on a benzodiazepine to get through a day, you need to think seriously about getting off of them, Lembeck added. Other warning signs of addiction include needing increased doses to get the same effect or resorting to doctor shopping to maintain a steady supply of the drug, she explains. Those are very worrisome signs because they indicate you've developed a tolerance and you're investing a lot of time and effort overcoming that tolerance. Essentially, you're taking it not to help with your sleep or anxiety, but to treat the withdrawal from the last pill that you took. Some users are now buying highly potent synthetic forms of these drugs on the internet, on the dark web, which also increases overdose risk. Lembeck believes that regulators and the medical community should restrict these drugs' uses by employing methods now being used to combat the opioid epidemic. But that still doesn't change all the lives that it has taken. And we can also, assume that not all people are going to follow these guidelines. Unfortunately, they weren't following them before, and they're probably not going to because they like the money and they really don't care. So this is why people have to look out for themselves and their family members and their loved ones for them. Now, for example, healthcare providers should be required to check a prescription database before issuing a script for one of these drugs to make sure the patient isn't addicted or misusing the drug in combination with other substances. That's what she suggests. Doctors also could require the urine drug screens to make sure benzodiazepines are being taken as prescribed and not combined with other drugs, Limbeck said. Physicians can also help by clearly laying out the potential dangers of the drugs. There has to be a level of caution, and board-certified doctors should be giving patients informed consent agreements for treatments. That way the patient knows exactly what's going on. It's a serious thing, and a lot of doctors don't even spend 10 minutes with you in a room, let alone sit down with you and tell you. They probably shelf this stuff out so fast and so much that they don't even care anymore. They just write it up and send you on your way. So you really have to be careful and look out for your loved ones. If you know somebody who's addicted to these are things you should be doing. And if you're on them, get some help. Thank you for listening. Go ahead and subscribe, like, and share this video. Have a good day.